What do you think would be the biggest solution for cutting down this barrier?
There's a very, very big gap in education. People do not know what are red flag signs of cancer.
Do you think that there's over-screening also that's happening?
So there are very strict criteria where patients should go into screening.
Would you say that every person who smokes should definitely go for a screening?
For 20 years, definitely.
Hello, Namaste. My name is Garima Kaushal and today we're here to talk about cancer awareness. With us, we have Dr. Rohit Rebello, Consultant Medical Oncologist, Zydus Cancer, Ahmedabad. Thank you so much for being here today. Welcome, Dr. Rohit. I want to kick off our conversation by asking you first, why is it so critical to have early detection in cancer?
So the fundamental concept in cancer is your cure rates predominantly depend on what stage of cancer you're diagnosed with. So a stage 1 cancer can have a 90% cure rate and a stage 4 cancer can have a 20% chance of survival. So that difference is basically depends on how early you're diagnosed with cancer. So that is why getting diagnosed early is the only thing that actually helps you in getting cured.
And does it help with care also, cancer care?
Definitely the aggression of treatment, the need for multimodality treatment of chemotherapy, targeted therapy, immunotherapy, radiation therapy and surgery will be lesser if you're being diagnosed with an early stage. For example, take first stage breast cancer. There are times you might get away with just a surgery without any chemotherapy. But if you are diagnosed with a third stage breast cancer, you will have to go with surgery, you have to go with chemotherapy, you have to go with radiation. So the morbidity as well as the side effects and complications to increase as the stage increases.
Then why do people ignore all the warning signs?
So predominantly I've done some global health work with IARC France, and predominantly what we found is patients do not have a knowledge, they don't know what are the early red flag signs of cancer. Most people do not, because we are not taught about it in school, and unfortunately it's not even a part of the MBBS curriculum where cancer is being dealt with in detail. Unfortunately, cancer has started increasing drastically over the last 15 years. So there's a lack of knowledge in the community about what the red flag signs of cancer are and when they need to seek help.
Okay, so what would these red flags be?
So basically you have loss of weight, you have any swelling anywhere in your body, you are coughing out blood, you're vomiting out blood, when you're passing motion, you're having blood, some altered bowel habit that lasts for too long, unexplained fever for more than 2 to 3 weeks. These are very important signs where you need to go and show your doctor, and your doctor needs to evaluate if these could be because of cancer.
So we say prolonged a lot of times. How much is a prolonged symptom?
So basically anything that lasts for beyond 2 to 3 weeks is what we call prolonged, because if it's an acute infection, it should resolve within 2 to 3 weeks. Something that does not resolve in that period of time needs to be investigated.
So these are the red flags that you've just mentioned. Do you think that there's over-screening also that's happening?
Yeah, so most of the screening trials, like for prostate cancer, the screening trial kind of found that, you tend to over-investigate patients. So there are very strict criteria where patients should go into screening. Now, cervical cancer is something where screening really helps. Lung cancer, if you're a smoker for more than 20 years, screening actually helps pick out these lung cancers at a much earlier stage, help you get cured. So when you're screening a person for cancer, right, you need to be very sure that you don't land up over-investigating. So there are very strict screening criteria and guidelines that need to be followed when we go for screening. The most successful ones are in oral cavity, in breast, as well as in cervical cancer. So in these three, even India and throughout the world, screening programs have really helped save lives.
Okay. Any advice you would like to give to the patients, like the people, that when they go for screening, what is it that they can look out for? Because the reason why I'm asking this is also बहुत बार ऐसा होता है कि people think कि अरे हम hospital जाएंगे तो फालतू के टेस्ट कर देते हैं, डॉक्टर्स ज़्यादा टेस्ट लिख देते हैं, वैसा एक दिमाग में आता है लोगों के. तो what is it that people can actually look out for कि okay ये चीज़ें तो ज़रूरी हैं, ये करवानी ही चाहिए?
So any person who's coming to a hospital and wants to get screened is a well-educated person, because people who are not very well-educated do not know about screening, and this has data to back it. Okay. So if you are educated, you can always question your doctor as to why are you screening me at this particular time? What guideline are you following? So breast, we have guidelines. So in India, we do clinical breast examination and not mammogram. In the US, it is mammogram, but in India, you do a clinical breast, and then if you find something suspicious, you go for a mammogram. That's based on data from Tata. So cervical cancer, pap smear, was something we have been doing for the last 30-40 years, but now we do HPV testing also. Okay. So there is data for this. And in oral cavity, just an oral examination by a qualified medical practitioner can pick out these cancers at a much earlier stage. So you can always question your doctor as to why you are doing these particular tests. And in the kind of place where I work, where I see patients from the upper strata of society, our patients always have these great questions, and we love to answer them. We love to educate our patients such that they can spread that education to the community.
Now, that's really sweet of you, but not every doctor does that. We have a variety of people, and not blaming them also, but बहुत busy होते हैं लोग, back to back lines लगी होती हैं, so they also want to get done quickly. So anything that you can tell, like maybe 1 or 2 examples in which people can just look out for when they go, if they don't have that much knowledge.
So you can always look at the WHO criteria. Okay. You can look at what is the the Indian ICMR criteria, what they suggest for screening. But in India, you look at 3 predominant cancers: oral cavity, you look at breast, and you look at cervix. So these are the 3 cancers in India that have good data for screening. Okay. If you're a smoker and you smoked what we call more than 20 pack years, then you need to get your lungs also screened, because lung cancer is getting quite common, and air pollution also does contribute to lung cancer. Like you look at PM 2.5. So PM 2.5 is what your air purifier shows you. When you put on the air purifier, that number that you see is PM 2.5. The recommendation by IARC is it should be less than 10. But in India, at least the place where I live, it's beyond 150 at all points of time.
Yes.
So we are every day...
like for us, I think yesterday only I asked my sister, oh my God, there's so much pollution. She's like, no, we're at 15 right now. It's really good. And I was like, yeah, 15 does sound good. Like we've entered an era where less than 10 is a dream. Anything below 50 also is like, oh, that's good, right?
Yeah, in India, in metros, you will find it's beyond 150. Okay, in Delhi, it sometimes reaches 500 too. Yeah. So the air that we breathe is quite bad now. And then you add smoking on top of that, so your risk of lung cancer seriously increases.
So would you say that every person who smokes, say at least for 15 years, should definitely go for the screening? For
20 years, definitely. We are discussing that today in the conference too, that beyond 20 years if you smoke for at least 20 years, irrespective of the number of cigarettes you smoke, but you have a 20-year smoking history, there is a benefit of getting screened for with a low-dose CT scan.
And people who finish like packs a day?
So there is a correlation between the number of packs you smoke, and so when we say pack year, right? 1 pack year is if you smoke 1 pack of cigarettes which contain 20 cigarettes a day for 1 year, you smoked 1 pack year. So if you smoke 2 packs, it becomes, you smoke 2 pack years in 1 year. Yeah. Okay, so 20 pack years, you have to get screened.
That's some really good to know knowledge. Thank you so much. And do you think blood tests could revolutionize screening?
So there is one test, the Garden Shield. So we were lucky that it cost about 1,70,000, but we were lucky that in our organization we had 100 tests we did for free. I think the company did 2,000 tests in India for free. Wow. As a part of the validation. They were able to detect 7 cancers on people who were absolutely normal. Okay, so just routinely just came for a blood test, and 7 cancers out of 2,000 were detected in this particular blood test. It's very expensive. Okay. So 1.7 lakhs is not something that most people will be able to afford. And this is, I'm talking about a normal individual with no problem. I'm telling him spend 1.7 lakhs. So, he'd probably buy an iPhone 17 Pro. But, to get them to spend on health is very difficult. Yeah. So there are blood tests, and that's undergoing validation. Probably will get FDA approval next year. Okay. And probably we're going to see at least a certain class of people that are going to be starting to do these blood tests because of the fear of cancer.
Yeah. No, but do you see that, I think with time the rate of this would go down, the more accessible it becomes?
Definitely. Right? With time, what's going to happen is Indian companies, like what they do and just like how great Indian pharma has been to the rest of the world, they are going to replicate this and then do it for at least maybe 1/10 the cost.
Yeah, because it's really funny when you get blood test or any kind of test done and you spend a lot of money. Technically, you're happy that nothing came out, but a part of you is like, shit, I wasted all that money.
So yeah, that's a very funny thing that I have found with a lot of patients, that when you order an investigation and it comes negative, they are more angry. And when it comes positive, right, they're like, okay, the investigation is ordered for. But see, the point is, if it comes negative, you don't have cancer. So there's nothing greater than that.
Yeah,
okay, so I think that's something.
I think that's the only place that would happen, that you are happy also, but you're sad also, is in a medical test.
Yeah. Some amount of corporatization of healthcare needs to be blamed for this. But eventually the bad gets weeded out in the system. And that's something that's happening over the last 4-5 years, where people are realizing that where the good lies and where the bad lies. And, thankfully in the world, the good always, overtakes the bad.
That is something everyone will have to go through and get over it in their own way. But my last question for you is that what do you think are the barriers that are preventing early diagnosis or early cancer care?
So when we were doing the study with IARC, right, we did it in Rajasthan itself. What we found is there are a lot of social factors. It depends on which part of the world you're working in. But you look at, we did this study in 3 states of India. We did it in Kerala, we did it in Tamil Nadu, and we did it in Rajasthan. And all 3 states threw out different results. So the barriers in Rajasthan was, for a woman going for breast cancer screening or cervical cancer screening, who's going to take care of their kids? I'm going to take a day off work, who's going to pay for me? How will I reach the hospital? How will I get back? Me going to such a big hospital, where do I go to get screening? So there are multiple social factors, and the social factors actually play a predominant role in people not wanting to get screened, because we need to remember that these are normal individuals who are completely healthy. You're asking them to leave 2 days of work, come get certain tests done. That's not that easy. And most of these screening tests are not free, so pay for those screening tests. So that barrier still exists. And there's also a fear of being diagnosed, in the sense that they say, people always think that if I go to the hospital, I'll be diagnosed with cancer. That fear actually exists. But we need to change this, mentality, and that's only going to happen if we start introducing this at the school level, because, that's where you capture most of the people, and, the kids can probably discuss with their parents, or the mother is teaching the child, so they will also learn in the same time. So that there is a big barrier when it comes to education, and I think by correcting this barrier, we'll be able to get more people into screening.
What do you think would be the biggest solution for cutting down this barrier?
So as I said, it's all going to be education, because what we found in focus group discussions, as well as in, we had questionnaires, and it was all a data-driven implementation, science-based research protocol. What we finally found is there's a very, very big gap in education. People do not know what to look for. People do not know what are the red flag signs of cancer. And the only way to disseminate that to the general public is going to be through education. See, education can also be through the media of television, the media of radio, the media of social media. The government can invest in these platforms and try to disseminate that knowledge to the general public.
That's so true, and that's why we're here. We hope that with this Q&A, we're able to spread some awareness. Any last thoughts that you would like to share with our audience?
Yeah, so I think early diagnosis is something that will help you get cured of cancer. And that's only possible if you're diagnosed in stage 1. So don't be afraid or be scared of getting diagnosed. I think you should be happy to get diagnosed with an early stage of cancer rather than be picking it out on the late phase. And one must always remember that pain is a feature of late stage cancer and not a feature of early stage cancer. So don't wait for something just because it's not hurting you. Pain is always a symptom of late stage malignancy.
Thank you so much, Dr. Rohit. That's it for today. And we hope you really take away something from this conversation. Please go ahead, get yourself screened. Do not ignore the symptoms. They are red flags. Early screening, early detection means better care. Thank you so much.